My 9-year-old son is a non-verbal autistic child with intellectual disability and ADHD. I am his sole carer. He cannot speak for himself, so I am speaking. On 23 May 2025, he was admitted to Sunshine Ward of University Hospital Limerick because his mental health had deteriorated to crisis level. Severe agitation, aggression, distress, and psychotic-like episodes that could no longer be managed at home without medication. The accident and emergency doctor had told me they had no remit to prescribe for what he presented with, and since he had no medication to go back home to use, he was being admitted for a specialist to come assess him and prescribe medication for him. This admission had a clear purpose: assessment and medication to stabilize him, and it worked. Within days of admission, my son was prescribed aripiprazole. Hospital staff observed and reported the positive response to aripiprazole. The male consultant pediatrician who looked after him had himself told me how aripiprazole was going to be approached. He became calmer. He slept. The aggression and distress stopped. For the first time in months, he was regulated. That response mattered. It showed what happens when care is actually provided. But after discharge, and away from the eyes of medical staff who had looked after him, everything changed. On 3 June 2025, at the CAMHS ID assessment that took place at the County Clare CAMHS ID offices, based in the Spindle unit of St Joseph's Hospital in Ennis on the day of discharge, the medication that had worked, aripiprazole, was removed. No clinical explanation was given. Instead, the same consultant psychiatrist who had refused to assess or treat any of his symptoms for months prior to the hospital admission placed him on Medicanet, a stimulant used for ADHD. And this matters. Aripiprazole treats autism-related irritability, aggression, mood instability, and psychosis, the very symptoms he was admitted to hospital for. Medicanet does not treat those symptoms. It is not intended for autism-related aggression or psychosis, and in children with mixed presentations, it can worsen agitation and distress. The consultant CAMHS ID psychiatrist who did this has over 30 years medical experience. I took my son home from the assessment. He had spent 11 nights waiting at University Hospital Limerick for an assessment that this same psychiatrist had refused to carry out while he was in hospital waiting for it.